Hello, and thank you for joining us on The Deep Dive. Today we're unraveling the complexities of a really challenging health issue in horses, equine lymphosarcoma, also known as lymphoma. We've pored over quite a bit of leading veterinary research and clinical texts, including detailed excerpts from equine lymphosarcoma, basics, diagnosis, and treatment, and also equine lymphosarcoma. Diagnosis, treatment, and prognosis to bring you the most critical insights.
Yeah, our mission for you today is really to cut through the noise, try to demystify this often elusive disease, and, distill the essential knowledge so you can truly understand a condition that, well, while it's not incredibly common, it holds a unique and significant place. It's actually the most frequently diagnosed blood-forming tissue cancer in horses.
Right. So if you've ever found yourself wondering how veterinarians navigate such complex, sort of hidden illnesses in large animals, or maybe if you just appreciate a deep dive into biological puzzles, you're definitely in for some unexpected facts and, I think, vital understanding.
Okay.
Let's get into it. To start, can you maybe paint a clear picture for us? What exactly is equine lymphosarcoma at its core?
Okay. At its core, lymphosarcoma is a malignant cancer. It's of the lymphoid tissue. So you can imagine it as this uncontrolled overgrowth of specific white blood cells called lymphocytes.
Okay, lymphocytes.
Exactly. And these cells are absolutely vital for the immune system. They act as the body's defense force, really. The cancerous cells involved are primarily B cells or T cells. Those are two main types of specialized immune cells. And knowing which one is affected, well, that can tell us quite a lot about the disease's likely behavior.
That makes sense.
Yeah.
And speaking of its behavior, it's fascinating to me that the sources highlight it as the most common tumor of the equine hemolymphatic system. That's basically the horse's blood and lymphatic system, crucial for immunity, right?
Mm-hmm.
But at the same time, its overall prevalence is actually quite low, less than 5% of horses. Can you help us sort of understand that paradox?
Yeah, it's a great observation, and it's certainly a bit counterintuitive. You're right, it affects horses worldwide, and it is the most common type of blood cancer you'll find in horses.
Right.
However, compared to, all the diseases horses can get, or even other cancers, its overall occurrence is relatively rare.
I see.
What's striking, though, is that while it can manifest at any age, literally from a fetus to a senior horse, maybe 25 years old, we most commonly diagnose it in horses between 5 and 10 years, or sometimes the range is given as 4 up to 15 years old, depending on which study you're looking at.
Okay.
And there's no clear sex predisposition either, although, interestingly, the form that affects the skin seems to be a bit more common in thoroughbreds.
Okay, thoroughbreds. Now, this next part is truly remarkable because, as you hinted, this isn't a one-size-fits-all disease. The sources describe 4 main forms based on where the tumors actually appear. And it feels like understanding these anatomical distinctions is absolutely crucial for any horse owner or anyone involved with horses.
It is, absolutely. Recognizing these forms is, well, it's key to interpreting the varied clinical signs you might see. First, we have the multicentric or generalized form. That's the most common one.
Okay.
This involves multiple organs throughout the body, often presenting with broadly enlarged lymph nodes and infiltration into organs like the spleen, the liver, the kidneys.
Wow, so it's widespread.
It is, and the clinical signs for this form are usually systemic and tend to be quite non-specific, just generally unwell.
Right. And then there's the alimentary form, which means it impacts the digestive tract, I assume.
Exactly, spot on. This specifically affects the gut, especially the small intestine. It's sometimes even referred to as juvenile lymphosarcoma because, well, it can be seen a bit more often in younger horses. And owners often report things like chronic weight loss, which makes sense because of poor nutrient absorption, maybe protein loss, recurrent colic, and diarrhea.
Okay, colic and diarrhea, key signs there. And the third form, mediastinal. That sounds like it targets the chest cavity.
It does, yeah. This form is located right in the chest, affecting the mediastinal lymph nodes and/or the thymus gland. It can lead to some pretty serious respiratory distress, coughing. Sometimes you see jugular distension because blood vessels are being compressed.
Oh, wow.
And even difficulty swallowing, dysphagia, if the esophagus gets squeezed by the tumor mass.
Okay, that sounds quite severe. Finally, we have the cutaneous form, which sounds like it would be maybe more visible, easier to spot.
It often is, yes.
Yeah.
This form involves the skin and/or the tissues just under the skin, the subcutaneous tissues. It typically appears as single or multiple firm, non-painful nodules or plaques.
Nodules, okay.
Yeah, and they can range quite a bit in size, say from 1 to maybe 20 centimeters in diameter. What's interesting about these nodules is their behavior. They can appear suddenly, grow really slowly, just stay the same size, or sometimes they even shrink
Oh,
and then
no.
reappear later. Yeah. While local lymph nodes might get enlarged, it's actually quite rare for this specific form to spread to internal organs.
So for an owner, recognizing the unique manifestations of each form must be absolutely critical for potentially catching it earlier, right?
Precisely. And that understanding of the varied presentation leads us directly to the next crucial and often pretty frustrating question: what actually causes this chameleon-like disease?
Yeah.
Unfortunately, the exact cause is largely unknown. We have theories, of course,
Okay.
including genetics and the potential involvement of certain viruses, like equine herpes virus 5, EHV5.
EHV5.
Yeah, it's been implicated in some cases, but a direct causal link hasn't been definitively proven yet. There's also the possibility that unspecified environmental factors might play a role. We just don't know for sure.
Right, so it's still a bit of a mystery. Given how varied the forms are and how hearing the causes are elusive, it really sounds like diagnosing this condition could be quite a diagnostic puzzle for veterinarians.
It truly is a challenge. It really is. The clinical signs are often so vague, so nonspecific, which means a high index of suspicion is absolutely necessary. You have to be thinking about it.
Right.
Common nonspecific signs include things like chronic weight loss, just dullness, maybe reduced appetite, decreased performance in athletic horses, intermittent fever that you can't explain.
Fever of unknown origin.
Exactly.
Okay.
And eventual edema, that's swelling, particularly under the belly. Anemia and enlarged lymph nodes are also frequent findings, but again, not specific just to this.
But then, as you said, there are those more specific clues depending on the form, like the chronic colic and diarrhea for the alimentary type,
Sure.
or the breathing difficulties for the mediastinal form.
Exactly.
And with the cutaneous type, those distinctive skin nodules are a clearer red flag, I suppose.
Indeed. And just to add another layer of complexity, sometimes, though it is rare, horses can develop these things called perineoplastic syndromes.
Oh, yes, you mentioned those. Tricky.
Very tricky. They're fascinatingly difficult symptoms caused not by the tumor itself taking up space, but by chemical signals or substances the tumor releases into the body, affecting distant organs or systems.
Like what?
Well, a rare but significant finding here is hypercalcemia, high blood calcium.
Okay.
And that can cause its own array of problems for the horse, like kidney dysfunction or muscle weakness, making the whole diagnostic puzzle even more complex.
Wow. So when signs are so nonspecific, how do vets actually, confirm the diagnosis? What are the key steps in solving this particular mystery?
Well, a systematic approach is crucial. Really crucial. Initial steps usually include a thorough clinical examination, getting a good history, and running comprehensive blood work.
Standard stuff first.
Right. But the lab findings are often quite variable and, again, nonspecific. They typically just point towards maybe a chronic inflammatory condition, showing things like anemia, low albumin, maybe high globulins.
Okay.
Interestingly, the lymphocyte counts remember those key immune cells. They're usually normal or even decreased. An increased count, what we'd call lymphocytic leukemia, is actually pretty rare in horses with lymphoma.
Good.
So imaging techniques like ultrasound of the chest and abdomen become incredibly valuable for actually visualizing any internal masses or seeing if organs have been infiltrated.
Makes sense looking inside.
But the definitive diagnosis, the absolute confirmation, truly hinges on finding those neoplastic lymphocytes, the actual cancerous cells.
Right.
And this is done by taking a sample, usually through aspiration with a needle or a biopsy of an affected lymph node, a mass, or maybe fluid from affected body cavities like the chest or abdomen.
Oh, we're getting a sample.
And histologic examination of biopsies, looking at the tissue structure, is often preferred over just looking at cells under a microscope, cytology. It's generally easier to differentiate cancerous lymphocytes from simply reactive but non-cancerous lymphocytes in a proper tissue sample.
So a tissue sample is really the gold standard then. That gives the clear answer.
Exactly. That's the gold standard. And on those samples, we can perform even more advanced tests like immunohistochemistry, IHC, or PCR for antigen receptor rearrangements, which is often called PARR.
POR. Okay.
Yeah, these tests essentially let us look at the cancer cell's unique sort of genetic fingerprints and surface markers. This deeper look is crucial because it helps vets determine if it's a B cell or a T cell lymphoma.
Back to the B and T cells.
Right. And that distinction can significantly influence how aggressive the cancer is likely to be and what treatment might work best or how well it might respond. T cell lymphomas are often considered more aggressive.
Got it. Okay, so once that diagnosis is confirmed, what's the path forward for these horses? It sounds like it could be a challenging road ahead.
It is challenging, absolutely. And treatment is often palliative. That means the primary goal is usually to improve quality of life and manage symptoms rather than achieving a complete cure, unfortunately.
Palliative care. Okay.
It typically involves a multimodal approach, combining different things like surgery where possible, chemotherapy, corticosteroids, and really comprehensive supportive care.
Okay, so surgery isn't always the answer then.
Yeah.
You mentioned many forms are diffuse, spread out. Is it fair to say that for many horses, surgery might feel like, I don't know, chasing a ghost, trying to catch something that's already spread?
That's actually a pretty good way to put it, yeah. Surgical removal is truly best suited for solitary, localized masses, like some specific cutaneous tumors or maybe a tumor on the spleen, and only if we think we can achieve complete removal, get clean margins around it.
Right.
But, as you suggest, most forms of lymphoma are unfortunately already diffuse, already spread by the time we diagnose them, making full surgical removal just impossible.
Right. And what about chemotherapy? That sounds like a difficult decision for owners, too.
It is. Chemotherapy is increasingly attempted, although it's often less extensive than what you might see in, say, small animal oncology. A lot of that comes down to the significant cost and just the logistical challenges of treating a large animal like a horse over time.
Sure, yeah.
Common agents include things like prednisolone or dexamethasone. These are corticosteroids, which have the advantage of directly killing lymphocytes. We also use drugs like chlorambucil, and sometimes more aggressive multi-drug protocols are tried.
And how well does it work?
The response is quite variable. Complete remission is, sadly, rare. But partial improvement or achieving stable disease, just stopping it from getting worse for a while, those are more common outcomes. And that can offer precious time and improved comfort for the horse. Of course, side effects like bone marrow suppression or gastrointestinal upset have to be monitored very carefully.
Are there other options, like radiation? And how do vets and owners typically weigh that really difficult choice of treatment, especially given the prognosis?
Yeah, radiation therapy is an option, but it's primarily for localized superficial tumors, like maybe some skin forms, and its availability is quite limited geographically and facility-wise.
Okay.
Hormonal therapy, specifically using progesterone, has shown some variable results, mainly reported for some of the cutaneous forms, but really absolutely critical throughout any treatment plan is supportive care.
Right, just basic comfort and care.
Exactly. Good nutritional support, effective pain management. This is vital to manage the symptoms, improve comfort, and truly optimize the horse's quality of life, whatever treatment path is chosen. And you're right, the decision-making process is deeply individual. It's a constant balance of the potential for improvement against the animal's current comfort, the financial implications, and ultimately the owner's wishes and goals for their horse.
Yeah, that makes total sense. This brings us to the big and often difficult question.
Yeah.
What's the typical outlook? What's the prognosis for a horse diagnosed with lymphosarcoma?
Yeah, the prognosis for equine lymphosarcoma is generally considered guarded to poor, and that's largely because it is, fundamentally, an aggressive malignancy.
Guarded to poor. Okay.
Most untreated horses, particularly those with the multicentric, intestinal, or mediastinal forms, those internal forms sadly do not live beyond about 6 months after diagnosis.
6 months.
Yeah. And even with combination chemotherapy, life may only be prolonged by perhaps a few months in many cases.
That's a tough reality for owners to face. But you did mention earlier that the cutaneous form, the skin form, had a better prognosis. Is that a significant difference? Does it offer more hope?
It is a vital distinction, yes. Horses with the cutaneous form generally do have the best prognosis of the 4 types and often a much longer clinical course.
Okay.
These skin lesions, as we mentioned, can even regress spontaneously sometimes or with treatment. And some of these patients can survive well beyond that 6-month mark post-diagnosis. Some studies have reported median survival times of over 2 years. I think one cited 34 months for cases that achieved complete remission.
Wow, 34 months. That's quite different.
It is. So the specific form absolutely makes a massive difference in what an owner might realistically expect and, yes, hope for.
Well, that was truly an illuminating exploration into equine lymphosarcoma. Wow. From its its varied anatomical forms to the challenging diagnostic journey and that often guarded prognosis, we've definitely covered a lot of ground today.
We really have. We've seen how a single disease can present in such incredibly diverse ways, demanding, a keen eye from owners and vets for subtle signs and a really systematic diagnostic approach. Understanding these nuances is just so crucial for anyone involved with horses or, frankly, for simply appreciating the intricate complexities of veterinary medicine.
Absolutely. And as you reflect on everything we've discussed, maybe consider this provocative thought. Even with all our advanced diagnostics and our growing understanding of complex diseases like equine lymphosarcoma, perhaps the initial patient observation of an animal's subtle changes in behavior or appearance remains one of the most critical yet often underestimated steps in uncovering these hidden health challenges. Something to think about. We really hope this deep dive helps you feel more informed and maybe sparks some further curiosity. Until next time.